Hi everybody, I'm Dan. I've got Dr. Bilski here.
Good morning.
Yeah, good morning. So today we're going to be talking about dental makeovers.
Right.
So this is a cosmetic procedure.
Cosmetics for sure. Cosmetics, no dental insurance for that, no medical insurance.
So anytime there's cosmetics, it's sort of like out of pocket. Okay.
It's definitely out of pocket for sure. The biggest thing with cosmetics is that some people think they need cosmetic dentistry and they do not. Mm-hmm. And some don't think they need it and they do. And,
Gotcha.
and that's why you come to us.
Mm-hmm. So if they think they need it and they don't, I'm assuming you guys kind of try to talk them out of it, so to speak.
Yeah, not so much talk them out of it, but to educate them, to give them an idea, like what exactly does cosmetic dentistry mean? Mm-hmm. Your better cosmetic dental practices are the ones that do the least amount of dentistry for the greatest end state result.
Okay. That makes sense.
So in other words, we're as proud of what we do not do as what we do. Mm-hmm. So when it truly comes into a cosmetic situation, you have two options. Certainly there's always an orthodontic option, so maybe three. Or if you're not interested in the orthodontics, you're a mature adult, let's say you're in your 50s, you're not interested in doing that. We do what are called porcelain veneers or porcelain crowns. And an alternative option is what's called Provence. So Provence is acrylic, veneers is porcelain. So we say glass for porcelain, acrylic for Provence.
Okay.
And it's a cost difference. So the cost difference is about half the cost for acrylic, which is usually a non-drilling, non-Novocaine procedure.
That's
so
pretty good.
It makes sense. It should cost less, but it is highly cosmetic.
I was going to say, in that situation, is one better than the other?
I think, yes, I think one is better than the other, but it's like a goods and service. Is one better than the other? Example would be, I go to Bob Evans. I love Bob Evans.
Right.
Do you want butter or margarine on your toast?
Right.
Which one's better?
Yeah.
Some people may say no way margarine,
so it's
no way butter.
Right. So it's somewhat, an opinion is in there somewhere.
A perspective on what you feel is best. And you can talk to every dentist on the planet. There's going to be a little bit of a glitch or a glean of different information and perspective on that. But we're talking like true no-brainers. You need something done.
Yeah.
On adults, I typically lean towards the porcelain.
Okay.
Not always because of cost, but it's long-term restoration. It's called, what's the long term of this?
Okay.
Versus a 16 or 17-year-old that comes in, or college kid, that they want to do something, but if we drill their teeth to put porcelain veneers, what are they going to do in 20 or 30 years?
Yeah.
That only brings them to my age, 50.
Right.
Like, now I got to do it again.
Yeah.
Which usually means root canals, usually could mean gum surgery. Well, what if we use something that's reversible, like an acrylic?
Yeah.
The Provence?
That makes sense.
So everyone's specific. We've used combinations. We've done porcelain and then with Provence.
Okay.
The good news, we use Sapo Dental Arts. They're in Fairview. Nothing's coming out of the country or from out of the country.
It's all local.
All local. And we've had great results. You can see it on our website. I have personally published books and articles on these procedures.
Yeah.
I speak nationally and internationally on it. I'm not bragging. I'm just saying what we do.
Yeah.
And I also get a lot of other information when I'm on these events.
It's okay to brag a little bit.
Well,
I mean, especially when it's your craft and you're proud of it.
I am proud of what we do, and I feel comfortable, and I really like to make people aware of what's available.
Yeah.
So it's the education part. I guess we all do have egos, but what I always say is we try not to let our own egos and our proudness cloud our judgment or perspective.
Right.
If you wanted a makeover, Dan, tell me why you want the makeover.
Yeah.
What are you trying to accomplish? Are you going to be on TV or in the movies, or are you a public speaker? Or is it your significant other is talking about how they really feel you could fix your teeth?
Right. So that might be the person that really needs it.
Yeah.
What you're referring to.
We found that grandparents, their grandchildren,
Mm-hmm.
and one particular, hey, Grandpa, why are your teeth so brown?
Mm.
The teeth were healthy.
Yeah.
He was just 75 years old.
Yeah.
He used to smoke. He drinks a lot of coffee and tea.
Yeah.
Just your regular whitening.
Yeah.
Which means also whitening. That's just a cosmetic makeover, by the way.
Right.
So those that don't need cosmetics,
yeah,
they need a cleaning and a whitening. Beautiful.
There you go. So whitening is probably another topic we can get into at a different time.
Absolutely. Yeah, for sure.
But we should. And I guess just on the cosmetic side, you guys do whitening as well. So if you're curious about that, check the website out and learn more about that too.
There should be pictures up and give us a call. Come on in.